Hey everybody, it's Austin Chang, and as if 2020 couldn't get any worse, as you may have heard, Justice Ruth Bader Ginsburg passed away yesterday of pancreatic cancer, a disease that I literally help diagnose and treat every single day as a gastroenterologist subspecializing in advanced endoscopy. If you're not familiar with Justice Ginsburg, she has helped move our country forward with her work in gender equality and women's rights, and I highly suggest that you watch the documentary RBG documenting her life. It is so inspirational, and it certainly has inspired me through the years. First and foremost, my heart goes out to her family and everybody who's been affected by her passing, as well as everyone else's family who I will be mentioning in this video. And the reason I'm making this video is because every time a public figure like Justice Ginsburg gets diagnosed or passes away with a certain medical condition, in this case pancreatic cancer, I know a lot of people are looking this up, and so for today I'm going to be talking about the main things you need to know about pancreatic cancer, and I'll be talking about some misconceptions throughout the video, so if you don't want to miss it, please keep watching. Once again, my name is Austin Chang, and I am a gastroenterologist subspecializing in advanced endoscopy, which means that I went through additional training to be able to do the types of procedures to help diagnose and treat pancreatic cancer, which is why I'm here today talking about it. It's literally what I do every single day. Again, there is no personal medical advice in this video or on my channel, so if you have specific questions, you should always ask your doctor to see if it applies to you. And as always, please remember to check who you're trusting online and make sure that they have the credentials to be talking about what they're talking about. Remember, there's a lot of misinformation out there, so feel free to look up multiple sources to make sure that you're getting the most accurate information possible. Okay, first and foremost, what is the pancreas? Pancreas is this organ that sits behind your stomach. It's represented in yellow in this model, and it sits between the first part of your small intestine, the duodenum, this pink structure here, and your spleen. Now through this video, I'll be referring to different areas of the pancreas, such as the head of the pancreas, which is this part of the pancreas, the body of the pancreas, and the tail of the pancreas. It's responsible for making the hormone insulin that gets secreted into your bloodstream to help regulate your sugars. And it's also responsible for making enzymes that get excreted into your small intestine to help digest your food. Now, second of all, what are the symptoms of pancreatic cancer? Fact of the matter is most people with pancreatic cancer don't develop symptoms until later on in the course of the disease. There's often no pain, there can be weight loss when people aren't trying to lose weight, and sometimes there can be jaundice, and we often think of painless jaundice as one of the hallmark symptoms for pancreatic cancer. But that's not always the case, and let me explain why. So pancreatic cancer can develop at any location within the organ. Now, one thing I have to mention is that the liver sits here above the pancreas, and it makes bile that drains down the green tube called the bile duct. The gallbladder comes off of the bile duct, and the bile duct tracks through the pancreas over here. So the bile duct runs through the head of the pancreas here, and as you can imagine, if the tumor happens to form here at the head of the pancreas, it could potentially block off the bile duct. When that happens, there's a buildup of bile that can then result in jaundice, which is yellowing of the skin. We can also see yellowing of the eyes. With that, we sometimes will see severe itchiness as well. There may be other specific symptoms that come with certain types of pancreatic cancer, which brings me to the first misconception about pancreatic cancer, which is that all pancreatic cancer is created the same. That, in fact, is not true. The most common type of pancreatic cancer is called pancreatic adenocarcinoma, which accounts for about 80 to 90% of all pancreatic cancers. Unfortunately, from what I've read, Justice Ginsburg had pancreatic adenocarcinoma. Other public figures include Patrick Swayze, and currently Alex Trebek is also battling pancreatic adenocarcinoma as well. Other types of pancreatic cancer include acinar cell carcinoma, and another rare kind of pancreatic cancer is the pancreatic neuroendocrine tumor. It just so happens that there have been several public figures who have died of pancreatic neuroendocrine tumors, including Steve Jobs, the founder of Apple, and the Queen of Soul, Aretha Franklin. Pancreatic neuroendocrine tumors are often made up of cells that are very actively making hormones like insulin, glucagon, somatostatin, or vasoactive intestinal peptide. These types of tumors can have very specific symptoms. For instance, vasoactive intestinal peptide can cause really massive amounts of diarrhea. The prognosis for pancreatic adenocarcinoma versus the neuroendocrine tumor varies greatly, and I'll be talking about that a little bit later in the video. Okay, so managing pancreatic cancer is a team sport. From diagnosis to treatment, it involves not only gastroenterologists, but also surgeons, radiologists, oncologists, so it really is a team effort. The third question I often get asked is, how is pancreatic cancer diagnosed? Because there are often no symptoms until later in the disease, we often will pick up smaller tumors just incidentally when people get imaging for other reasons. Once we see something that is suspicious for cancer or something precancerous, one of the things that I can do as an advanced endoscopist is what's called an endoscopic ultrasound. So I can go through the mouth with a scope, which is a long tube with a camera on the end. And this special scope also has ultrasound capabilities. So I can do an internal ultrasound and see through the wall of the stomach and look at the pancreas and potentially sample any tumors or masses that I see using a needle that I pass through the wall of the stomach. I can get some tissue, send it off to the pathologist, and they can look at it under a microscope and tell us whether or not there are cancer cells there. Now, the fourth thing I'm going to talk about is what is the treatment? Like many other cancers, if the cancer isn't locally advanced or hasn't spread anywhere, it can potentially be removed. Now, depending on where the tumor is, it may involve removing half of the pancreas. It may involve a procedure called the Whipple procedure, where this entire area is removed and everything is reattached. Often there can be chemotherapy or radiation therapy before or after the surgery, and if it can't be surgically removed and there are complications, like for instance if the tumor is blocking off the bile duct, that's my job where I come in and I can go into the bile duct where it usually drains out into the intestine and go into the green tube, which is the bile duct, and place a stent to open things up to prevent the tumor from continuously blocking off the flow of bile. The fifth question I often get asked is, what is the survival? What you may know about pancreatic cancer is that yes, it tends to be a very deadly disease compared to some of the other cancers that we know. Now, pancreatic adenocarcinoma tends to have a worse prognosis than pancreatic neuroendocrine tumors. Currently in 2020, the 5-year survival rate of pancreatic cancer in general is about 10%, which means that out of 100 people, 10 people will survive 5 years out. The earlier you detect a tumor, the more likely it can be removed and the better your chances of long-term survival. According to existing data, the 5-year survival for something that's localized is about 37%, whereas something that has spread and metastasized elsewhere, the 5-year survival is about 3%. Now, it's important to remember that these percentages refer to where things were at when the cancer was first diagnosed. Now again, this may vary from person to person because certain cancers may be more aggressive than others, and like I said, pancreatic adenocarcinoma tends to have a worse prognosis than pancreatic neuroendocrine tumors. As time goes by, survival may improve. We've seen an improvement in survival by a couple percent even within the past decade, so hopefully we'll see more improvement over the next couple of years. Now keep in mind that Justice Ginsburg reportedly underwent surgery for a pancreatic tumor in 2009, which really goes to show how tenacious she is. So how do we prevent pancreatic cancer? How do we reduce our risk? Some of the known risk factors for pancreatic cancer include age. Of course, this cancer tends to be diagnosed in people who are older, definitely smoking, obesity, and other conditions like pancreatitis or inflammation of the pancreas, which can often be caused by gallstones or alcohol and many other types of conditions. Now for another misconception, and that misconception is that everyone can get screened for pancreatic cancer. Unlike colon cancer, there is no general screening recommendation for everybody out there. But if you have family members who have had pancreatic cancer in the past, it's worth asking your doctor whether or not screening is appropriate for you. There are certain types of conditions that do carry a higher risk of pancreatic cancer, like Poitz-Jaeger syndrome, Lynch syndrome, and a couple others I'll list here. Anytime cancer screening is recommended to the general public as a whole, they often have to weigh whether or not that type of screening is going to overwhelm the medical system. As you can imagine, if millions of people suddenly are getting CAT scans or MRIs, it may prevent other people from getting those studies. As it is now, there's often a wait for those types of imaging studies, so we have to weigh what resources we have. We also have to weigh the risk of false positives and the risk of people getting radiation with CAT scans and other types of imaging studies like that. One thing I'll mention is that because more people are getting CAT scans and MRIs for other reasons whenever they have belly pain or other types of symptoms, we often will pick up certain types of precancerous pancreatic cysts, which are fluid-filled sacs that sit in the pancreas. There are recommendations based on the size and appearance of these cysts to potentially get these cysts sampled, which is another part of my job, to see if there are cancer cells. We can monitor these cysts over time, either with these types of procedures or imaging studies, depending on its size and appearance, and we can see if there are any changes and potentially detect cancer earlier. Alright, I know I've thrown out a lot of information in this one video. Hopefully you found it helpful. Once again, my heart goes out to the family members of the iconic Justice Ginsburg. And of course, Justice Ginsburg's story will continue to inspire me to fight against this terrible disease, and hopefully her story will help inform many people to get diagnosed and treated earlier. If you have any questions though, please leave them in the comment section below. I'll try my best to get to them. If you like this video, please give it a thumbs up. It would really help me out. And if you want to see more from me, please click the red subscribe button below and turn on notifications by clicking the bell icon. And if you want to follow me on social media, I'm at Austin Chang MD. I'm on virtually every social media platform and I use each platform very differently. Okay, until next time, please stay healthy and I'll see you in my next video. Bye!